So I figured, well,
Irma Gomez has been helping scared, pregnant young women in McAllen, Texas for decades.
It's our responsibility to help, to encourage, to do something.
That's why she eagerly followed the debate over HB 2, a far-reaching pro-life bill passed last year that hit the Texas abortion industry hard. Here's what HB 2 does. It bans abortion after 20 weeks. Only doctors can prescribe abortion pills like RU-486. Doctors who perform surgical abortions need admitting privileges at local hospitals. And abortion clinics must meet the same safety standards as other ambulatory surgical centers. Abortion supporters have fought these last two mandates the hardest.
They keep claiming that that this is somehow a targeting of them, but what we're saying is that if they can't meet minimum safety standards for women, then they shouldn't be in business.
On the national front, pro-life advocates believe this debate over safety could help turn the tide on abortion. They point to abortion doctor Kermit Gosnell. His conviction over illegally performing late-term abortions and killing babies after failed abortion attempts has helped to jumpstart a new public conversation about the need for regulation.
I think that there's a greater awareness now of the fact that the legal abortion industry is the red light district of American health care.
Which leads us back to McAllen. Following the groundbreaking law, its only abortion clinic and a dozen more across the state shut down rather than follow the new safety requirements.
A hallway has to be large enough to have an ER gurney come down the hallway if there is a complication. That makes sense. That protects the health and safety of a woman.
Abortion supporters immediately responded that the closures would harm women's health. For Gomez and others who help women in need, however, the clinic's shut down came as a blessing.
It was very exciting. It was just very exciting because I said, well, at least there'd be less opportunity for these precious girls to go and look for help there, not knowing what they were getting into, really.
There are many clinics across Texas. We call them clean clinics because they do not perform abortions and they do not do referrals for abortions. There are many healthcare providers that are more than willing to meet the needs of Texas women.
Now this fight is in the hands of federal judges. Legal appeals maintain the law is less about safety and more about limiting access to abortion. Still, pro-lifers believe they may have a winning case if the Supreme Court should decide to weigh in, and that could come soon.
The abortion industry would like us all to believe that this is something we should put behind us and we should just move on, that this is a settled status quo in America, but it's not.
In the meantime, pregnancy centers in McAllen and elsewhere will continue to help women in crisis rethink attitudes about life and prepare for the birth of their babies.
We need to help each other. We need to encourage each other. Say, well, mijita, there's another way besides doing that.
Heather Sells, CBN News.